Good evening, fellow gardeners. We have a guest with us today that we want to talk a little about the coronavirus. This is Brock Myers. He's a flight nurse and a flight paramedic, and I want him to talk to you a little about this coronavirus so that we can all stay healthy and clean, so we can garden and not pass this on to other people if we get it. All right, Brock, glad to have you. And I'm going to turn this over to you.
Thank you.
And I'll get out of your way.
Yeah, thank you. All right. Well, thank you, Leon, for the introduction. And yes, it's really interesting. There's a lot in the news these days about coronavirus. And so I thought that we could just take a few minutes to discuss what is coronavirus and what are some of the things that we can see, and maybe look at some of the things that are true and maybe some of the things that are maybe more of a myth when it comes to coronavirus. So it's interesting because the coronavirus is actually a family of viruses, a large family of viruses. And there's currently many types that we already have circulating within the human family. So this is about the 5th strain of coronavirus that they've identified. There's 4 others that we commonly see, even in the healthcare profession, when we transport patients that are sick. It causes respiratory problems, and they are very much like flu-like symptoms. The other fact about coronavirus is that they are zoonotic. Zoonotic means that they transfer between animals and humans. And this is not the first time. If you've ever heard of bird flu, swine flu, any of those other animal-type flus, that's where they stem from in origin, is from the animal population, and then we also see them jump over into the human population, which causes some problems. Now, there's a lot in the news in question about how is this particular virus spread. If I'm sitting on an airplane full of people, am I going to automatically contract the coronavirus? And the answer is simply no. You will not contract the coronavirus. It is actually spread through what we call droplet contact. So that means that if I'm actively coughing, sneezing, or touching an infected surface, then that's where I'm going to end up being sick. Some of the symptoms that we see with coronavirus are very similar to what we see with the flu. So you're going to have chills, maybe a headache, you might have some shortness of breath, pneumonia-like symptoms. Those are things that we commonly see, and that's why it makes it hard to distinguish, do I actually have maybe the coronavirus, or is this just the common flu? They're very much closely related. And that's what makes it difficult to decide, is this coronavirus or is this just the common flu? In terms of what the World Health Organization has to say about this virus, it's really pretty interesting, because it says they recommend standard precautions, which means regular hand washing, covering your mouth and your nose when you're sneezing, avoid close contact with anybody who's showing respiratory illness such as coughing and sneezing. So from the World Health Organization, this is their recommendation. How can we stay safe? Through basic preventative measures that all of us should know and should practice on a regular basis. The CDC has the same kind of recommendations. They say that be careful with people who are in close contact with each other. They recommend at least 6 feet of distance for somebody who might be sick or feeling sick. And you're only going to be at risk, of course, when you see somebody coughing. If they actively cough in your face or they sneeze in your face, that's when you're going to be at risk. You will not contract it if you're breathing the same air as somebody else who is infected. So you have to actively touch it, and this is why hand washing is important. We can't overstress the need for hand washing. Wash your hands, wash your hands, wash your hands. That is one of the best preventative measures for making sure that you will not contract coronavirus. And they think that most people are most contagious when they are showing symptoms. So if somebody is asymptomatic, if they're not showing any symptoms, they don't have a flu, they don't have a cough, they don't have a cold, then they're not going to be contagious until they actually have those things presenting. So it's just important to know. And maybe dispel some of that panic and that fear that is certainly going around. And I think a lot of it is just misinformation. People are not informed on what's happening. They don't know the symptoms. They don't know how the disease is spread. And the media, unfortunately, is just not doing an excellent job in reporting exactly what's happening with the situation. Of course, it's a community disease, so that means that communities at risk, and who is at the most risk? Anybody who is immunocompromised or sick. So our elderly populations are definitely the most risk. We haven't actually seen the younger population suffering from this particular disease, so we haven't had any deaths from children, which is a great thing. It really actually comes down to your health. If you're in poor health, this is a concern. If you're not in poor health, it's not as big of a concern. So the Wall Street Journal actually had some great tips. And Wall Street Journal, of course, they're concerned about our money. They report a lot on the financial situations here in the United States. And they said, stay calm. And I would totally agree. That's probably one of the best tips, is just to remain calm. Follow the same precautions that you would for preventing any other flu or any other virus. And I thought that was really sound advice. Wash your hands, cover your coughs and your sneezes. Stay at home if you're sick. That's a huge thing. If you're sick, don't go out in public. Stay at home and nurse yourself or nurse your family back to health. Should you wear masks and gloves? No, that's not going to help you. Unless somebody in your household actually comes down with an illness, you don't need to wear a mask or a glove. So there's some really good advice out there. If you just look up some of the facts, can't trust what the media is having to say about it, you need to do your own research, read between the lines, and find out what's really happening with this particular outbreak. So a big question that we have is death rate. How many people does this actually kill? And the average seasonal flu strain kills about 0.1%. So we're at about 1.2% of the population that is infected with the flu will actually succumb to the flu or die. In 1918, the flu was unusually high. It had about a 2% kill rate of anybody who was infected with the flu. Now, recognize 1918 was a very different time frame. We didn't have the same access to IV treatments for dehydration as we do today. So there was a higher death rate. But now they're actually saying, they just did a recent study, Harvard did a recent study, they found out that the kill rate for the coronavirus is actually 1.4%. So 1.4% is only 0.2% higher than the regular flu season kill rate. So this is not a need to be extremely alarmed. This is a cause for concern, but not to spread mass panic like what we're seeing in some situations across the United States and even Europe. So what can we do? And I think there's a lot of basic things. Leon, you're on a great track when you're promoting nutrition. Nutrition. It's key. Nutrition is key. We need to stay healthy by eating good, nutritious food. So that means your plant-based whole food as much as possible, fruits and vegetables, and lots of them. Dark leafy greens. These are the things that are going to give us prevention against catching the flu. Washing your hands, basic sanitation, hand hygiene. And even beyond that, there's also some other amazing things that we can do, taking some supplements like vitamin C and all those things too that really help us as well. But the biggest thing, I think, is to just stay calm and wash your hands. In fact, the CDC has a poster, and it's one of my favorites. It says, keep calm and wash your hands. So that's the recommendation, even from the official channels in the government. And I would agree that this is a situation we need to keep calm and wash our hands.
Okay, Brock, thank you for coming on board with us and helping our subscribers to stay healthy. If you enjoy this video, subscribe, punch the button, and we'll make you another video.
Yeah,
Thank you,
absolutely.
Brock.
And one more thing on that.
Okay.
We have a channel as well on YouTube, and you can look up Gideon Rescue Company on YouTube, and we have a couple videos out there as well. We do disaster response, and so we see these things, and we're going to be releasing some videos on this very topic as well. So you'll see us talking more about this if you go over to our YouTube channel, Gideon Rescue Company, and also our website, GideonRescue.org.
Okay.
GideonRescue.org.
Okay, so we want them to stay healthy by eating healthy,
Yep.
drinking plenty of water,
Yep.
getting their exercise,
Yep.
washing their hands.
Yep.
And what else, Brock? What am I missing?
Those some great. That's a great start.
Stay
Yeah,
calm.
stay calm.
That's right. Stay
Yeah.
calm.
Yeah.
Thank y'all for watching. We'll see you on the next video.